Hi everyone, welcome to another session with Dental Shadowers. Today we are so pleased to have Dr. Schmitt with us. If you guys have any questions for her, feel free to leave them in the chat and we'll reach them at the end. And with all that being said, the floor is all yours, Dr. Schmitt.
Okay, perfect. Hello, everyone. It's really good to see everybody. Thanks for joining. I'm just gonna try to minimize something here. Okay. There's no way I'm trying to get rid of the sidebar with all the names, but I don't think there's a way to do that. Oh, there is. Okay, perfect. Okay, so my name is Dr. Rojin Schmitt, and I'm a DMD 2020 graduate from UBC, or University of British Columbia, from Vancouver, BC. And I'm excited to be sharing today's presentation. Here's a list of what we'll be discussing today. So the journey to becoming a dentist, all the steps that it takes to finally become a dentist, my unique journey. As you know, everybody's timeline and path to dentistry is quite different. So I'll be sharing my journey with you guys. Tips on applying to dental schools, undergrad tips, things to keep in mind when you're going through undergrad before starting dentistry, and why I chose general dentistry. The day in the life of a general dentist and my practice, the kinds of procedures I do in my practice, as well as what to look for in a practice once you're done dental school. And I'll be going over 3 cases with you. And there will be a Q&A session at the end where you can discuss any questions that you have. Okay, here we go. So the journey to becoming a dentist, I'm just out of curiosity, what kinds of basically, what is the demographic here? Are you guys the majority of you in undergrad? Are you finished undergrad? I'm interested to know where you guys are at. If you don't mind sharing just in the chat. Undergrad, senior, post-bac, master's, undergrad. Okay, great. So it seems like the majority of you guys are in undergrad, which is excellent. I'll kind of try to go over this faster, not to spend too much time on this. So everybody knows that you have to graduate high school, attend a college, university of choice. It could be anywhere from 4 years, maybe less, maybe longer, depending on your degree and academic load. You can choose to do any major. I get a lot of DMs on my Instagram, people asking me what kind of major they should choose. And I always tell people that it's not so much about the major, whether you did pharmacology or psychology. It's not so much what you did that matters, but rather your grades and all the prerequisite courses and your DAT score. Of course, we all know you have to score well on the DAT and you apply to dental schools, and this can be done during your 4th year undergrad or afterwards. You attend dental school. This is another 4 years, and upon completion, you either receive a DDS or a DMD, which are pretty much the same thing. If you're in Canada, you have to pass the National Dental Board exam. If you're in the States, it's the INBDE, and I've actually taken both. And depending on which province, if you're in Canada, or which state you're in, you have to complete any additional steps, such as the jurisprudence exams. I know the US is always changing the exam for different states, but the ADEX exam seems to be the one that tends to be the more commonly accepted exam to do after you've done the INBDE. And residency is optional in dentistry. If you choose to specialize, it's typically during your 4th year of dental school or afterwards. And the program can be anywhere from 1 year if you do a GPR or general practice residency to 5 years if you do an oral maxillofacial surgery residency. So these are the steps to becoming a dentist. Now, here is my journey to becoming a dentist. I did my undergrad in kinesiology and health sciences at UBC. I took a full course load, 4 to 5 courses per term. I did some summer school, and I graduated in 4 years. I graduated in 2015 from my undergrad. I took the DAT twice, actually. The first time I took it, it was in 3rd year undergrad. I wasn't really familiar with the exam, so I hadn't really prepared well, so I didn't actually end up doing too well in it. So I took it again in 4th year. And what I learned from my second time taking it, I recommend studying at least 2 full months prior. When I took it in the spring of my 4th year undergrad. And basically I was doing still a full course load, but I was studying for it quite a bit. I recommend studying 2 full months. I started volunteering as a research assistant with a prosthodontist at the cancer agency here in 2nd year undergrad. Prosthodontist is a type of dental specialist that deals with prosthetics, such as dentures. They do lots of dentures, lots of complicated mouth rehab. So she was a researcher and a prosthodontist. And I basically found her through emailing all the UBC dentistry profs. UBC is a dental school here in Vancouver in Canada. So it's my local dental school. I emailed all the UBC dentistry profs and she was the only one that got back to me. And I basically was a volunteer research assistant. I started at the beginning of my 2nd year undergrad, and I actually ended up staying on for 7 years, all the way up to 4th year dental school. It was a really great experience. I was involved in 3 research projects in oral cancer and got to present in 2 international conferences, which was really great. My other extracurricular activities included being a swim instructor, lifeguard. I did a lot of tutoring high school students. I was a mentor at Big Sisters, which is an organization. I don't know if you're familiar with it in Canada, where there's basically little girls from lower income families who need a mentor, somebody to meet with them to make sure they stay on the right track and help them with some tutoring courses too, and the Canadian Cancer Society event coordinator. So the takeaway from volunteering or extracurriculars that I have for you guys is try to choose something that you're truly passionate about, because if it's something that you're passionate about, you're more likely to stay on long term, which is what a lot of schools really value. So you want to pick something that you're interested in, you're passionate about, because if you do that, then you actually enjoy going to volunteering, and you end up staying on. You're more likely to get a good reference letter. And in addition to staying long-term or planning to stay long-term at a position, I also recommend choosing something that has some leadership capacity to it, because that's something that a lot of schools look for. Because as a dental student and as a dentist later on, you're kind of the team leader. You're the one that takes care of all the other staff and makes sure that the practice runs smoothly, whether you're a practice owner or an associate dentist. I actually had a gap year after I finished undergrad, and I used the gap year to practice for the MMI, which is the multiple mini interview. It's the type of standardized interview that's used in a lot of medical schools and dental schools across Canada. Are you guys familiar with the MMI concept? Is that something that's done in the US or not so much? Yes, okay, so it seems like you guys are familiar with it, which is great. So yeah, I took this year to practice for the MMI with my partner, who was a pre-med at the time, and I tried to enjoy my gap year. We went backpacking, and I received an acceptance letter from UBC Dentistry. So the most important piece of advice I can give you guys is to start planning your journey early. It's a lot of people nowadays, they think that, if they're in 1st year or 2nd year, they still have time to figure it out. But the earlier you start planning, the better and the faster you end up getting to your goal. Of course, everybody has a different timeline, and it's not so important when you get to dental school. You don't have to get in there right after 4th year undergrad. Everybody has a different timeline. What matters is that you get there eventually, and everybody's on a different timeline, and that's okay. But I would just say that if you're thinking about doing dentistry, try to do it as early as possible, because there's a lot of planning that goes into it.
It's like 40 people. This is crazy.
Okay, now some tips on applying to dental schools. Again, you want to make sure that you do your research. Every school tends to have different requirements, whether that be prerequisite courses or reference letters or different types of extracurriculars. I know some dental schools require a certain number of hours of shadowing. Some schools really value research requirements. So you make sure that you've done your thorough research, maybe pick a few dental schools that you think you have the highest chance of getting in, and really try to make sure that you know what the requirements of that school is and aim towards meeting those requirements. You want to apply to schools that have similar acceptance statistics as yours. A lot of schools basically publish the acceptance, the entrance statistics of the following or of the preceding year. So you want to make sure that you look at that and you aim for those schools where you think that your scores will be competitive. You can throw in a dream school, but don't overdo it because you can end up wasting your time. If your school has a predental club or something like predental shadowers, I highly recommend you join the school's predental club so you can meet other predental students. You can learn from other people's paths. And I joined the UBC predental club when I was in second year undergrad, and I met so many people who were very similar to me in terms of obviously being hardworking and goal-oriented. And we made a core DAT study group. And it was also so nice to see the upper years make it into dental school. They'd come back, they'd give us tips, studying advice. So I highly recommend that you become involved in some sort of predental shadowing. We all know that high academic performance on the DAT and also in undergrad are very important, but they're not enough to get you into dental school. It's important to have a well-rounded application. And again, as I said, most schools look for long-term extracurricular commitments that show your genuine interest. I highly recommend shadowing a dentist if it's your own dentist, or if you know dentists in the community, reach out to them, ask them if you can shadow them, or better yet, become a DA or a dental assistant. A lot of dentists, because there's a huge problem with being short-staffed, they'd be willing to train you to be a DA or dental assistant, and you can, maybe work as a DA. So get paid, potentially get a really great reference letter from the dentist, become familiar with the profession. It would really reinforce your interest, confirm your passion in the profession before going into it. Do sports, join the choir. The list can be very long. So choose a few things that resonate with you and that you're truly interested in. And again, the shadowing and working as a DA, we already talked about that. It's really important because a lot of schools, for example, my school, UBC, required 70 hours of shadowing. So if you're working as a DA, not only are you getting the shadowing and the hour requirements, but you're also potentially getting that reference letter and learning more about the profession. You're entering the profession with some appreciation of what it entails. You've seen different procedures, so you're more familiar with it than somebody who's never experienced it before. And here's again more tips for you. Start mapping out your undergrad as early as possible to increase your chances. For example, have a rough plan for when you'll be taking all the prerequisite courses. Are you taking all the chemistry courses in first and second year, and then you're taking biochem in third year, or when you're taking all the other prerequisite courses? Give yourself lots of extra time, be proactive, and don't wait until late undergrad to start shadowing, volunteering, doing research, and all the other things, because chances are late undergrad, you'll be studying for the DAT and you'll be working on your applications. You'll already be quite busy with other things. Improve the academic component of your application, because if you don't have that academic component, it doesn't really matter how many shadowing hours you have and how much extracurricular experience you have. So choose your classes wisely. If you're taking 2 or 3 science classes, add an easy art or photography class, add a GPA booster course. It'll create a good balance, making your semester more manageable, and it won't drop your GPA. And again, try to get shadowing experience early. Reach out to your local dentist. If you just give me 1 second, I'm just going to deal with my cat who's meowing. Sorry about that. So try to get shadowing experience early, reach out to your local dentist, ask if you can shadow them. Better yet, become a DA. We already talked about this. This will give the opportunity to get shadowing experience, be exposed to different clinical procedures, confirm your interest in the field, and hopefully get an excellent reference letter. And chances are, who knows, maybe you start shadowing in first or second year undergrad, and you decide that maybe dentistry isn't for you. Maybe you thought it was quite different. And then, actually getting to see what it entails, you might decide that this is entirely not a career path for you. Then you're not going to end up wasting your time and potentially, change your mind very last minute, or worse, getting into dental school and then realizing that it's not for you. So shadowing is super important. I highly recommend that for you guys. Join your school's pre-dental club, which we talked about, and start creating your application early on by logging all of your extracurricular activities. This is actually a great idea. So I recommend keeping some sort of a journal, where you keep track of what kind of extracurricular activities you did, maybe log all your hours. Not only will this come in handy when you're working on your dental school application, because oftentimes they ask in chronological order, what did you do? What kind of volunteer activity did you do? What kind of work experience did you have? How many hours did you do in each? And later on, when you are hopefully doing your interview for a specific dental school, they'll ask you what kind of, what did you learn from this experience? They might ask you about conflict resolution skills. They might ask you about so many different things, leadership experience, ask you questions pertaining to your personality. And, a lot of the interview questions start with, tell me about a time when ... So fill in the blank. So it's, if there's any experiences that stand out from different volunteer or work experiences, maybe jot that down, keep that in that journal too, so that keep a highlight of the different experiences and what you learned about yourself, what kind of skill you learned, what kind of, hardship you experienced, and things like that. So it's really helpful, not just for when you're working on your application, but also later on when you're practicing for the interview, because they do ask a lot of personal questions to get to know you better. And that's when it will become really handy, bringing personal experience from your past, volunteering or work experience or different things like that. Personal statements. So this is a pretty important aspect of dental school application. You want to use your personal statement to tell your unique story. So, don't just try not to make your personal statement something that is cliched, or, don't make your personal statement so much be about what you think the admission faculty is trying to hear, but rather use it to tell your own unique story. Highlight your long-term extracurricular activities that have inspired and confirmed your interest in becoming a dentist. If you've worked as a DA, this is a great place to highlight what you learned, moments that cemented your passion in dentistry, what basically piqued your interest in the profession, what you learned about yourself, what you learned about others. You want to make sure that you're really using this. You obviously want to be grounded and humble, but also you want to use this as an opportunity to sell yourself to the admission staff and to let them know that you would make not just a great dental student, but also a great dentist later on. So tell your story, not someone else's story, not what you think the admissions committee wants to hear. Try to stay away from, I'm choosing this profession because I like helping people, because there's so many different professions where you can, essentially help others. So try to stay away from using kind of redundant terminology or cliched, stereotypical things that you think others would want to hear. And, as we talked about, you just want to highlight why you think you would make a great dental student, dentist, team leader, be proud of all your accomplishments. You've worked hard to get here, and you want to basically use this opportunity to showcase, because sometimes the interview questions you might not get, of course, they look at your CV, they look at everything that you've done, but personal statement is a place where you can add on and embellish all your experiences and put yourself together as a package and present it to the admissions committee. So this is a very important aspect of your application. So definitely don't underestimate the importance of this, and don't spend too little time on it. It's good to be prepared when you're writing this. The interview is the next most important aspect. Once you are invited to an interview, you basically want to make sure that you're giving it your all, and you're presenting your best self, and you're putting your best foot forward. A lot of people think that they can wing the interview, but it's actually quite different from from just talking to somebody informally. It's dental and medical school interviews tend to be more structured. They ask outside of the box types of questions. Like I said, it's really good to keep track of all your experiences and all of your everything that you've learned about yourself, all the skills such as conflict resolution, self-regulation, leadership, different experiences, because a lot of the times they'll ask you, tell me about a time when blank. So that blank could be anything, but it has to do with you, your personality, but also they ask a lot of critical thinking types of questions, situational type of questions. They'll put you in situations where, you know, you're the dental student. And for example, there's a patient privacy breach. How would you deal with this? How would you do it? So the interview is very important. It's super important to work, to practice for the interview, for, I would say, 2 to 4 months in advance. As I said, when I had the gap year, I started, I knew that dentistry interviews would be held in January or February of that year. And I had that gap year. I started practicing for the interviews in October. So I gave myself October, November, December, and end of January was my interview. So I practiced for 4 months for the interview. It's really important to be familiar with what's going on in the world also. So I highly recommend you read your local and also the news pertaining to your country and the world. So local, obviously, for example, local would be what's going on in your city. Then it would be your state news. Then it would be the whole country news. So it's really important to know what's going on because they will ask your opinion on what's going on, what you think is going on in the world. And you want to basically make sure that you're not raising any questions, whether, you know, in terms of your political affiliation. You kind of want to make sure that you're neutral and you're being objective and you're showing them that you possess critical thinking ability and that you know, obviously possess integrity and things like that. I just wanted to briefly mention an app that my partner and I created. It's Pocket Medical Interview app, and it comes with over 500 practice interview questions in 3 different categories. And it's something that when we were practicing for med school and dental school interviews, respectively, back in 2015, there was really nothing in terms of interview questions that were available. The questions that were online were all redundant questions. And we basically, the courses that there's some interview courses that are offered by people that haven't gone into dental school or medical school themselves, and they were really expensive. So when we were in our final year of med school and dental school, respectively, we put together this question based on our own experiences of having gone through the rigorous interview procedure. So that's just something to keep in mind. But regardless, just, you know, you want to make sure that you're practicing for the interview, practice with lots of people. If you're in a predental club, it's really great to practice with other students who are also going through it. If you have friends who are pre-meds, med school and dental school interviews tend to be very similar. So the most important thing is you practice with lots of people to get as much exposure to those types of questions. Now, moving on to why I chose general dentistry. So what I really like about general dentistry is that it's always evolving and there's always new technologies and advances being made in our profession, which not only challenges clinically, but it also helps us serve our patients better. The reason why I decided not to specialize, well, for one, I was really ready to be done with school and not have to worry about more schooling, but also I like the fact that you get to do different procedures. If you're doing general dentistry, there's no way that you're ever going to get bored because, you know, say if you're doing any, and later on I'll speak about my practice, what I do in my practice, but it's basically really nice to be able to do all sorts of procedures such as restorative, pros, or doing crowns and bridges and cosmetics, doing veneers and BioClear, or doing implants, doing Invisalign, doing some Botox, you name it. It's being a general dentist, you can essentially do all the different procedures in dentistry. And if you're really passionate about any certain part of general dentistry, then you can go back and you can do continuing dental education courses in that area, and you can really hone your skills in that area and become really great at it. And there's essentially no dull moment being a general dentist. In my practice, I mostly do restorative, which is fillings, pros, which is doing crown and bridge and veneers, and I do a lot of cosmetics, so Invisalign, Botox, again, cosmetic veneers, doing smile makeovers and things like that. I don't like surgery and root canals, so I kind of try to stay away from those, which again, it's really nice because as a general dentist, you don't necessarily have to do everything. You can always refer if something is outside of your scope of practice. So it's really nice to be able to do that. And I love general dentistry because I get to do a broad range of procedures, get to be involved in a patient's comprehensive treatment planning. It's really nice as a general dentist, you're there with the patient from diagnosing to treatment planning together to actually doing the procedure and post-op, seeing how it changed your patient, how it impacted your patient's quality of life and confidence and things like that. Whereas specialists, you get a patient referral, you see the patient for that one procedure, and then you never see them again. So it's really nice because it allows you to make those lifelong, relationships with your patients. So again, that's another reason why I recommend general dentistry was the right career path for me. Day in the life of a general dentist, it's obviously lots of X-ray interpretations. You do your new patient exams, you take lots of X-rays, you spend quite a bit of time looking at X-rays and basically diagnosing what might be going on, whether there's an infection, whether there's decay, and you present all options and their prognoses as well as benefits and risks to your patient, and you help them decide what's a good treatment plan for them. You do a consult, lots of different procedures that keep you on your toes. It's, you got to be willing to step out of your comfort zone, especially when you first graduate. Everything seems really challenging because there's obviously, you don't have the 3 hours per patient that you had in dental school. Things have to move a lot faster. So that also forces you to always be a lifelong learner, lots of CE or continuing education courses. You're pursuing growth, you're learning, you're trying to balance work and life. And at the end of it, it's the colleagues and patients that make it so worthwhile. It's really important to work well within your team. And you're not only a team leader, but you're also a team player. So yeah, so now in terms of my practice, I practice in Vancouver, BC. As I already mentioned, I'm a general dentist. I work 4 days a week. So that's kind of 4 days a week working full time. It really keeps you on your toes. And starting this September, I'll be going back to UBC, which is the dental school where I graduated from as a clinical instructor. So I'm really excited for that. Factors to look for when you're looking for jobs. Later on, you want to make sure that you choose a practice that's productive and busy, because when you first graduate from dental school, you're a safe beginner dentist. It takes a long time. It takes a while for you to become comfortable with different procedures. And there's some procedures that you really master when you outside of dental school. So you want to look for a practice that's busy. You want to look for a mentorship, the practice owner to be, supportive of your learning and your growth, willing to mentor you in different procedures, willing to help you out. If there's any questions, there won't be any, you won't be ashamed to ask any questions. You can work together as a team to better help your patients and optimize treatment plan. You want to look for a wide scope of procedures. You don't want to be stuck in a practice where you're doing one procedure all day, every day, because that can get boring. And you can also, get burnt out very easily. Patient demographic is interesting. It's, some areas, patients can only afford extractions and dentures, and other areas you're more capable of doing cosmetics. So keep that in mind in terms of what your interest is. As I already mentioned, I'm kind of more drawn towards cosmetic dentistry, doing smile makeovers, doing, Invisalign, and then being able to do veneers or BioClear to really transform a patient's smile. So patient demographic is really important, because if you're interested in cosmetic dentistry, but you're working in an area or you're choosing a job in an area where patients might be of a lower socioeconomic status, then you might not be able to do that. So it's good to be cognizant of that. And if it's something that you're interested in both, then you could do half and half, where you can, work in an underserved community where you get to really help a patient, put them out of pain, whether that's extractions or root canals or things like that, while also doing cosmetics. So that's something to keep in mind. Supportive, positive team environment is really important. Dentistry is already very stressful. So you don't want to be in a team that might not be supportive or might be toxic of your growth. So you want to make sure you choose your team, you get to know them, you hopefully you get to work with people that are all committed to, optimizing patient care and working really well together. An owner willing to mentor / is patient with your learning and growth. We already talked about that. Those are all very important things to keep in mind, but that'll be something that for you to look out for more so towards the end of your dental school. But it's something that you kind of, it's good to know when you're in dental school, and it's good to know what to look for and what to not look for, so that you don't end up wasting any time. Now, on to the cases that we're going to go towards. I'm going to go over 3 X-rays. Not sure how much sort of knowledge you guys have about dental school. I know when I was in undergrad, I didn't have very much knowledge just from, this shadowing experience that I did and working some research. I knew some things, but not a whole lot. So I'll try to keep it really simple and not use too much dental jargon. So here we're looking at the lower right. We're looking at tooth number, using the Canadian dental system. If you look at tooth number 4-6, unfortunately, it's not letting me point, but the first tooth that we're seeing with the white on it, that's a crown. That's most likely a gold or PFM crown, gold or porcelain fused to metal crown. And so the crown actually looks fine. I'm not seeing any open margins. If you look at it, it's flush with the rest of the root of the tooth. So there's nothing wrong with that tooth. However, the tooth behind it, tooth number 4-7, the white thing that we see, again, I wish I could point because that would make it so much easier. But the white thing that we see, that's essentially an MO restoration, mesio-occlusal restoration. We can see that black shadow that we see underneath it, that's decay, okay, or recurrent decay underneath the filling that was there. And again, we see that big crack, okay? The big crack is essentially DOBL, distal occlusal buccal lingual crack that we see. And really trying to, okay. Can you guys see if I'm pointing? Can you see my cursor here?
Yes.
Yes.
Oh, perfect. Okay, that makes it so much easier. So here is essentially, we're seeing the crack. Again, we said DOBL. And then this is the nerve of the tooth. Okay, so this is the nerve of the tooth. And as you can see, the crack is into the nerve of the tooth. So this patient, in this case, presented with lots of pain from this crack. So I didn't see the tooth. It was an emergency patient. Patient had never been to our office before. So here, essentially what I guess would have happened was there was probably a large decay in the tooth. And every time there's a cavity inside the tooth is really compromised. You can imagine it's cavitated inside. So it's partly hollow and it's more prone to fractures and cracking, which is essentially what happened in this case. And the crack is inside the nerve. So in this case, the treatment that you would have to do on this patient, there's essentially 2 treatment options. One is doing root canal treatment, where essentially because there was decay and fracture into the nerve of the tooth, the only way you can save this tooth is you do a root canal treatment. And then every time you do a root canal treatment, the tooth, so basically how it works is you basically remove this pulp that's inflamed and you put filling material inside the root. So you can imagine the tooth has become structurally compromised now because it's already structurally compromised, of course, due to this crack, but also when you remove the nerve, then it's hollow on the inside too. So it's even more susceptible to crack and fractures. And sometimes, say if this crack was at the gum line, you might not be able to save the tooth at all. So that's why every time we do root canal treatment, we recommend putting a crown or a cap on, just like this tooth, to give the tooth more protection. So in this case, the diagnosis for this is essentially symptomatic irreversible pulpitis is the dental terminology for it. And this, one of the options, if the patient wants to save the tooth, is to do root canal treatment as well as a crown afterwards. Now, if the patient can't afford root canal treatment and a crown, which can be quite costly, the other option is extracting the tooth or removing the tooth. And then, you know, since it's a 4-7 or it's a second molar in the lower right, they don't necessarily have to put an implant in there because it shouldn't affect chewing that much, but that's an option if they were interested in restoring it then. But one important thing to know about dentistry is you always want to give your patients options in that, the different treatment options, because not every patient can afford every treatment. A lot of the time, saving a tooth can be pretty costly. For example, here, doing a root canal treatment, that in itself can be around $1,500, and then doing a crown can be another $1,500. So we're looking at $3,000 to save this tooth, although the prognosis would be okay. But extracting a tooth can be $400. So it's good to give the patient that option, and so that they can be empowered. And that's when you truly have informed consent, is when the patient knows all their options, the benefits, the risks, the prognosis, and then they can make an educated decision for themselves. Because at the end of the day, your job as a healthcare professional is to educate your patients and, you know, obviously do no harm, give them all the tools that they need to make a decision about their oral health. And at the end of the day, you want to leave it up to them. And this is a wisdom tooth that's impacted or inside the bone. And yeah, so that's this case. Case number 2, it's an interesting case. So we're looking at quad 1. This is tooth number 1-5, and this is tooth number 1-6. And as you can see, tooth number 1-6 has a DO, or distal occlusal restoration. And you guys see this shadow. There's this black shadow that's going on here. And usually cavities, the way cavities present is interproximal decay, or cavities in between teeth are the most common due to lack of flossing. So usually cavities start out in the enamel of the tooth, and they get larger as they go into the dentin, which is the layer underneath the enamel. But in this case, you can see it kind of starts here where there's the bone, and it kind of has this irregular shape. So again, I'm not sure what your guys' background is. Maybe some of you have done a lot of shadowing. Some of you might have done some dental courses or have watched YouTube videos and things like that. Does anybody have any idea what this black shadow might be? And if you don't have any idea, I don't expect you guys to, because it's something that you learn in dental school. It's okay. So essentially, yeah. Okay, so this black area is what's called resorption. So basically, nobody really knows what the cause of resorption is. Sometimes decay or a cavity can trigger a resorption, but essentially it happens when osteoclasts start breaking down tooth structure. And some of it, you know, again, some of the contributing factors are decay, some of it is genetics. It's more common in certain ethnicities compared to others. Some of it could be trauma to the tooth. Maybe this tooth was was hit in the past, or maybe the patient is a big clincher grinder, and that's kind of introduced micro cracks to the tooth, and that's how it started. But essentially, when you get resorption in a tooth, the prognosis of the tooth kind of goes down. Ways to save that tooth. So in this case, the patient was asymptomatic, meaning they didn't have any pain. So you want to inform the patient about what you're seeing in this radiograph. And essentially at that point, in order to keep the tooth from, because the osteoclast can basically keep going, and this resorption can expand further and further. So in order to save this tooth and preserve it from further damage and further resorption, essentially you have to remove this resorptive tissue. So again, doing root canal treatment and putting a crown on, that would be the best case scenario. You want to remove all of that, do root canal treatment to save the nerve, and then put a crown on, and that should help the tooth from further deterioration. Alternatively, if the patient doesn't have any symptoms, which was the case here, you can always give the patient the option to monitor the tooth. So you can take this type of X-ray, which is called a periapical radiograph. It's a type of X-ray that shows the root of the tooth. You can repeat this once a year to make sure that this isn't expanding, this isn't getting too big and too out of control. And you can always give the patient that option. But if this was my tooth, I would essentially want to do something about it because this is a silent killer of a tooth. Okay, and in this case, again, the patient had no recollection of any history of past trauma to the tooth, so it's unclear as to how this happened. Again, if it was decay usually starts in the enamel, but you can see this patient is highly restored, meaning they've got lots of restorations, lots of fillings in their teeth. So it's safe to assume that they might be at higher risk of getting cavities. Now, the last case, last but not least, we're looking at quad 1 again. So this is tooth 1-5. Again, I use the Canadian tooth numbering system because that's what I do all day, every day. So this is 1-5, this is 1-6, and this is 1-7. And this is an interesting case because, of course, you can see this tooth has had root canal treatment in the past. And again, it didn't get a crown on top of it. So as I mentioned before, anytime you do a root canal treatment where we remove the pulp or the nerve of the tooth is hollow on the inside. So you can imagine it's structurally compromised. So that's why we always recommend that the patient get a crown within the first month to protect this tooth from fracture or cracking. That's what we always recommend. In this case, the patient didn't, and this tooth was cracked at the gum line. So unfortunately, this tooth can't be saved, because there's so little tooth structure. You can see there's huge decay here. There's very little tooth structure remaining. It's hard to save this tooth. The prognosis wouldn't be so great. Sometimes in the case of teeth that have had root canal treatment in the past, there can be reinfection, because with root canal treatments, you always want to make sure you go all the way to the bottom of the root to prevent any, infection sitting here. You always want to go. So you can see this root canal treatment that was previously done. It's a short root filling. It doesn't go all the way to the bottom of the root. Preferably, we want to be within 0.5 to 1 millimeter of the apex of the tooth. Apex is essentially the root tip of the tooth. This didn't happen in this case. But essentially, sometimes, say, if this tooth wasn't badly cracked, if there was more tooth structure remaining and the patient had pain, what you can do is you can do retreatment. A lot of general dentists don't do retreatment. That's where you would refer the patient to an endodontist or a root canal specialist, where they basically go in and they remove previous root canal treatment and then fill it to the end. They'll remove any infected tissue here and they'll go all the way to the end. Or sometimes, if it's not possible to go from the top of the tooth, they might do apical surgery, where they do the root canal treatment. They go in from the bottom of the root upwards. And again, that's a highly specialized procedure. That's I've only seen it done by endodontists who are root canal specialists to do, because they spend 3 extra years in dental school specializing in root canal treatments. And again, this tooth that we're looking at, the 1-7, you can see it has what looks like a file separation here in the distal root. What that means is it looks like somebody attempted to do a root canal treatment, but the instrument broke. And that's just what's left in the distal root. And this black that we see here is infection. So in this case, this tooth is reinfected. So this patient needs root canal retreatment, proper root canal treatment and crown in the tooth. But this one doesn't have a good prognosis for saving it because there's too much tooth structure missing. So essentially, exo or extraction would be best for this tooth, and this one could be retreated, hypothetically speaking. Okay, so you guys feel free to follow me on Instagram and ask me any questions that you might have. Here, I'm going to open the floor to you guys and ask you if you have any questions so we can go over your questions.
All right, thank you so much, Doctor, for your informational presentation. It's very lovely. And let me take a look at the chat to see if you guys had any questions. I believe there was one or two. Okay, so the first question from Amanda asked, what advice do you have for students that don't have a predental club at their school?
So that's a good question. What advice would you have for schools that don't have predental clubs? So one thing is, depending on where your school is, you could always start a predental club at your school. That would actually be something that looks really good on your application, dental school application. If you know, that's of course, if you know others that would be willing to join your predental club. So you could always start it yourself. That would look really good on you in terms of leadership and taking initiative. Ultimately, there's other ways of joining predental clubs through Instagram, for example. So you guys are called predental shadowers. That's not affiliated with any school, is it? Are you kind of just like a general?
Yes, we are like
Yeah.
a general.
Yeah.
organization.
So yeah, you could join things like that on Instagram. Look for sort of generalized predental organizations that you could join. I've heard of Predental Association. I've heard of Bright Future Dentists. I've heard of Fresh Dental Shadowing. There's different predental sort of organizations that aren't specific to certain cities or schools, or more generalized through social media. As we know, social media makes things so much more accessible. So then you can, get to know other predental students that way. You can get to know, you can get to know about different things like that way. So that's what I would recommend if you don't have a predental club at your school.
Perfect. Thank you for your answer. So we do have more questions coming in. Leanne asks, during dental school, did you have a work-life balance?
During dental school. So I would say that once I was in dental school, my work-life balance was definitely much, much better than when I was an undergrad, because when you're an undergrad, there are so many things you need to juggle. It's not just when you're in dental school, when you're an undergrad, there's so many more things you need to juggle. For example, studying for your courses, there's your degree requirements that you need to keep track of, what courses you need to take in order to graduate on time, but also all the prerequisite courses for dental school, which may not be the same as degree requirement courses. So there's that. There's also studying for the DAT, there's shadowing, and there's volunteer/work experience. So there's a lot more that's going on. So you might have less time for working out and self-care and things like that. However, when you're in dental school, you kind of can just kind of relax and just focus on being a dental student, which is, at least you have one goal, which is to meet all the requirements to graduate dental school, to become a safe practitioner, and to pass your boards and things like that. So I would say I did have much better work-life balance when I was in dental school. Of course, it's challenging because you're so used to taking 4 to 5 courses per term when you're an undergrad, but when you're in dental school, you have no control. It's one standardized, structured curriculum. You don't have any say in terms of how many courses you want to take per term. I remember when I was in first year, we had something like 9 courses per term. So it's definitely really intense and really challenging academically, but also later on as you're in second year and third year and fourth year, it's not just academically challenging, but it's also, there is clinical practice introduced, and you're doing a lot of procedures for the first time, and dexterity takes time to develop. So but the good thing is you have a lot of support. You have a lot of instructors that are there to help you and to be patient and supportive of your learning, but also you have classmates that are going through the same thing. So it's really nice to be going through dental school as a cohort, as opposed to an undergrad. You might be the only pre-dental student in your classes, and you kind of might not have anybody else to bounce ideas off of. So it's really nice because in dental school, you're kind of all going through the same thing. Everybody's going through the same challenging curriculum. So I would say work-life balance. Of course, you need to make time for yourself. Self-care is really important. There's lots of mental health support that they have to dental students, medical students, because as we know, burnout is really common in those 2 different programs. So I wouldn't worry about the work-life balance of dental school, because it's something that you'll learn as you go through it, and there's lots of support, hopefully.
That's good to hear. And we do have more questions. Let's see. During your time in dental school, did you work, and what motivates you to go to the office each day now that you are working?
During dental school, when I was going through dental school, I didn't work. Actually, I don't know if any of my classmates did, and that's because it's such a rigorous program, as I already mentioned. You're in school pretty much for close to 9 hours a day. You're just in classes and clinic, and then we had what's called evening practice, which is optional clinic sessions where you can go in and you can practice clinical skills that you want to improve upon. It's outside of the curriculum. So I was essentially in school for 12 hours a day, and the weekends we had off, but of course we had projects and assignments and studying to do. So I personally, if you're capable of not working during dental school, I wouldn't recommend working during dental school, just because it's such a demanding program that you want to make sure that you're giving it your all, giving it your 100%. There's the rest of your life to work as a dentist afterwards. So there's no rush to get to that working stage, essentially. And plus, as I mentioned, it's important to give yourself time, spend time for self-care and socializing and things like that.
Yes,
Well, I
so that's
didn't.
very important. All right, so we have Amanda asking, how did you pay for dental school?
So I personally paid through student loans. In Canada, we have line of credit available to professional students. So that applies to dental students and medical students. And the majority of my classmates that I know of, they also paid for dental school through line of credit. So that's pretty common. And of course, that means you graduate with a huge debt, but you'll slowly be paying the debt off when you're working.
Yes, thank you for your answer. Next question is from Rabab. She asks, any advice for someone who is committing to dentistry later in undergrad?
So the advice I have is, obviously, as I mentioned, you want to make sure that you have a strong academic component. So if you already have really good grades, undergrad grades, that's great. If you don't, then you want to make sure that you're enhancing the academic component of your application. So that would mean maybe you have to go back and you have to do more courses to raise your GPA, or maybe you can look into doing a master's degree that's course-based to increase your GPA. So you really want to get your academic component up, obviously studying really hard for the DAT and doing really well on the DAT. So that's that. And just making sure that you set aside time to do the shadowing and the work experience to make your application as strong as possible. But essentially, as I mentioned, everybody has their own timeline, so don't be discouraged if you've decided to do dentistry in your 4th year of undergrad, because at the end of the day, when you get into dental school, it doesn't matter how old you are. When you get into dental school, it's a fairly fast program. It's 4 years. It's not like medicine where you do 4 years of med school and you have to do 5 years of specialty and things like that. It takes forever. So the dental school, the good thing about dentistry is it's 4 years. So although it's long, it's not that long. And if you're sure this is what you want to do for the rest of your life, you should be encouraged that you've found your passion and pursue it no matter what. So don't be discouraged. Don't compare yourself with others that might be much younger than you or things like that, because at the end of the day, it doesn't matter. Once you get into dental school, everybody starts out equal from the same place, essentially. So that would be my advice to you.
Amen to that. Okay. Our next question from Jonathan says, why dentistry instead of medicine?
That's a good question, because when I was in 1st year undergrad, I wasn't quite sure if I wanted to do dentistry or medicine. I was initially I was looking into medicine only, because I had a lot of sort of personal experience from family members and things like that. I thought I wanted to do medicine. I always knew I wanted to do something. I wanted to do a career in healthcare. But essentially, it wasn't until when I was in 1st year undergrad, when I started volunteering at a hospital, that I realized that medicine wasn't for me. And that was because I was working at the volunteering at the ER, and I noticed that I found medicine really emotionally challenging and emotionally draining, because you're seeing patients that are extremely ill. A lot of the patients I was seeing at ER were terminally ill, and I just found it really sad. The patients that you're talking to, you're internalizing their pain, and that can affect your life. So I realized that medicine wasn't for me anymore. And that's when I decided that since I wanted to do something in healthcare, and I knew I really wanted to work with my hands, I was always interested in doing procedures and working with my hands, I started shadowing a dentist. And that's when I realized that it's really great. It's a really great profession. It's in healthcare. You're still improving patients' quality of life and confidence. You have the chance of doing a smile makeover and really transform somebody's smile and therefore their self-esteem. And you also get to work with your hands, and it's a profession that has great job autonomy. You decide how much you want to work, how many days, how many hours, and it's really nice in that sense. And the ability to be able to build lifelong relationships with patients. Again, as I mentioned, as a general dentist, you get to be there just like a family doctor would throughout their entire life. Diagnosis to treatment planning to doing the treatment and then following up on them afterwards. And you also get to meet their family members, their children, their spouse. And it's really rewarding in that way. But the lucky thing is with medicine, it can get very sad and it can get very emotionally draining. And that was something that I found out early on, that it wasn't a career path I wanted to pursue, because that can be hard on your mental health. So yeah, I hope that answers your question.
Thank you. Leanne asked a similar question, but did you consider any other work fields besides like healthcare? And did you always know that dentistry was the career for you? Like, what was your aha moment?
So I don't know if the answer to the previous question answered this one, but essentially I never thought about anything outside of healthcare. Healthcare is kind of all I knew. It was just what I was drawn to. So it was choosing between medicine versus dentistry. And again, I chose dentistry just because of the relationships you get to build with the patients, the procedure based, you get to do procedures, like I would say 90% of the day you're doing procedures, and the rest of it would be obviously documentation, paperwork. And it's really nice to be able to work with people all day, every day. Of course, it has its own challenges, but it's what I was drawn to personality wise. So
Thank you. I do have one last question. We are at the time, but my question is, what is the best advice that a dentist gave to you when you were shadowing or when you were predental?
the best advice that a dentist gave to me when I was shadowing or predental. I'm not sure if I got really good advice, but I essentially, I'm just trying to think and I'm drawing a blank here. But the best advice I would give to you guys is not to be discouraged. Keep working hard at it, and it's something that if you have a goal, again, if you have a dream, make it a goal, because you can't just be dreaming and hoping that something will happen without putting the effort in. It's something that I've learned in life in general, is if you want to succeed at something, you really have to be able to work really hard on it. So lots of efforts day in and day out will eventually pay off. And before you know it, you guys will be in dental school and then practicing dentists and so on and so forth. So it's the same when you're, it's the same as in when you're in dental school, and then afterwards when you graduate, if you are choosing dentistry, you have to be committed to being a lifelong learner, because the learning never stops. When you're in dental school, obviously you're learning every single day, but when you graduate, a lot of dental students think that that's it, that they're done learning and they're done with the books and things like that. But as I said, general dentistry as a field is such a hugely evolving profession. It's always changing. There's always new technologies. There's always new materials. We're always learning new things. We used to do a lot of amalgam restorations, for example, and now we're finding out that they cause a lot of damage to the tooth. They're not conservative. They cause cracks over time. And now we've completely switched over to composites, and materials change. And you have to be willing to be open-minded and be willing to be a lifelong learner. So if you're somebody that doesn't enjoy learning and doesn't enjoy books and things like that, then dentistry might not be the best option for you, because if you just want to go to dental school, do the 4 years, and then that's it, that might not bode well for you, because you're always learning and you always have to be open to learning new things and doing lots of continuing dental education courses. To keep your license here in Canada, you actually need to do 90 hours of dental education, continuing dental education, every 3 years. So that's actually a requirement built into the licensing requirement of our profession. But even if that wasn't the case, it's something that you need to be open. So the best advice I would have for pre-dental students, obviously, number one, if you have a dream, make it a goal, and don't just hope for the best. That's not enough. You need to be willing to put in the effort day in and day out. And number two, you have to be willing to commit to becoming a lifelong learner, because that's what the profession demands from you. And that's what you should be willing to do in order to serve your patients best. I hope that helps.
Yes, that was a great answer. Do you have any other closing remarks for the pre-dental students before you go?
My closing remarks would be, again, I think I tried to emphasize shadowing as much as I could. It's something that you learn so much about the profession, but it also helps you potentially getting a reference letter too. You want to make sure you're shadowing. If you can be a dental assistant, that's even better. But I would just say, be honest with yourself in terms of what your weaknesses are in terms of your application. If it's the academic component, look into ways to increase your GPA. If it's your DAT, really study hard, give it your all, and then take your DAT. If it's your extracurriculars, then look for those long-term extracurricular activities that you're actually genuinely interested in. So you're not looking forward to going into those extracurricular activities. So just be honest with yourself in terms of where the weaknesses of your application are, and try to strengthen those parts of your application.
Well, thank you so much, Doctor, for taking the time out of your day to join us and sharing your words of wisdom, and for your lovely presentation. I really enjoyed it, and I hope you guys enjoyed it as well. And we will have a quiz afterwards, so you guys can get your hour in. And then with all that being said, thank you so much, and we'll conclude the meeting here. Let me end the
Perfect.
recording.
Thank you so much. And would you be able to send me the recording?
Yes, of course.
Yeah. Okay, perfect. Thank you so much, guys, for
Yes.
being here on a Wednesday afternoon, and best of luck to your application. And let me know if you have any questions. I'd be more than happy to help you guys out. And again, I hope all of you guys get into the program.
Yes, and we do have her tagged into our post, so if you guys want to follow her. She does post a lot of informational stuff on her account. You guys can reach out to her there as well. Thank you, everyone, for joining us.
Bye.